Hello everyone, hi, I'm Dr. Kaur. I'm a GP in Cardiff in Kefili, and I'm also a yoga and mindfulness instructor. Today I will be looking into anxiety related to the falls. For example, if somebody has got a history of osteoporosis and had a first fracture or first fall and resulted in a fracture, and that person is bound to feel more anxious that I should not have the fall again, or what if I had a fall again. All that anxiety starts because of the fall. So let's look into it, how we can manage this anxiety, or what's the root cause for the anxiety. What is anxiety or worry? They are just the negative thoughts. They are not the facts, they are just the negative thoughts. And when I get the negative thoughts, when my own energy levels are low. So we need to look into how I can improve my energy levels to reduce these negative thoughts. Yeah. So energy, where do we get energy from? We do get energy from food and hydration. So eating balanced diet, healthy diet, not only helps with our physical health but also helps with our mental health, does reduce anxiety and depression. And then drinking plenty of fluids is important. Why fluids? Because if I am hydrating properly, I am bound to feel less lightheaded, less dizzy, and that will reduce the risk of falls. And coming back on balanced diet, as I said, it also helps with the physical health. If somebody has got a osteoporosis, we know that we should be eating more calcium in the diet. So eating with awareness, eating that is my food having enough calcium, like for example certain foods, broccoli or milk products, they give us more calcium. Just eating mindfully or making some little changes in the diet to stay more healthy and improve your energy levels. So where do I else get energy from? Sleep. If I am having a good night's sleep, then obviously I will be feeling more happier the next day. Yes. So how I can improve my sleep? If somebody, I'm sure in this room, or like if I ask how many of you get good night's sleep, maybe 90% people will raise their hand, they are not getting a good night's sleep. Yes. So how I can improve my sleep? So maybe thinking about the sleep hygiene. Yes. So that's a completely separate topic, but relaxation exercises, breathing exercises, mindfulness, all these can help in reducing the anxiety, improving the energy levels, and also can help in improving the sleep. Yes. And then obviously avoiding tea, coffee, drinking more water, avoiding alcohol, all these are the stimulants that can increase anxiety and reduce the sleep. So food, hydration, sleep, breathing exercises, mindfulness. What else? How I can improve my energy levels? Yeah. So staying active, doing some regular physical activity is important. For example, setting small goals. Maybe start with short walks and then gradually improve your distance of walking. Yes. And then exercises like yoga, tai chi, all these improves the physical strength, also helps with the mental health, helps with reducing the anxiety, and at physical level improves the balance, coordination, so many benefits. So getting some regular exercise, maybe a chair yoga, tai chi, as I said earlier. And what else? How, if I'm still feeling anxious after doing all these, looking after my energy levels, I'm still feeling anxious, now what next? Maybe talking to your trusted friend. Yes. Or maybe a family member, just having an open discussion, positive discussion, why I'm having this anxiety, or what else I can do to improve this anxiety related to the falls. So having that open discussion is important. Maybe speaking to your doctor, and I'm sure you'll find up, when we sit together, we can find up with some better solutions. What else? Then physical health, looking after your physical health. Having your regular eyes check is important, because poor vision can increase the risk of falls. If somebody has got a cataract, then it can increase the risk of falls, because if you're not seeing properly, then you're bound to fall. Yes, having your regular hearing checks. Then when you're walking, make sure your footwear is right, your shoes are right. That's important. Tight fitted shoes are important. What else? Then after that, obviously, if you're still feeling that something is not right, how about speaking to your doctor, having your medication reviews, because certain medication can increase the risk of falls, because certain medications can cause dizziness, lightheadedness. So having medication review with your doctor, talking to your doctor about some falls risk assessment. Your doctor can do a falls risk assessment, or they can refer you to the falls risk assessment clinics. Yeah. And then in your home, make sure that your environment in the house is safe. Yes, if there are any loose rugs or any hazards in your home environment, that can be fixed. So looking into all these factors are important to prevent the anxiety related to the falls, and also it can help you build up the confidence to improve your physical health as well as mental health. So I would say, suggest, be happy, stay safe, be kind to yourself, be generous, and everything will be taken care of. Thank you.